The use of daily aspirin for heart health in older adults has come under scrutiny, and the findings are quite alarming. A recent study led by a team from Monash University has reaffirmed earlier research from 2018, revealing that healthy seniors who took a low-dose aspirin every day faced a greater risk of severe bleeding without any significant cardiovascular benefits. This raises critical questions about the long-standing belief in aspirin's protective effects for heart health in the elderly. The latest research, published in the European Heart Journal, involved a substantial cohort of 15,668 adults from Australia and the United States, primarily aged 70 and above. These individuals had previously participated in the Aspirin clinical trial, which focused on those without any prior history of cardiovascular diseases, dementia, or physical disabilities that could limit their independence. After the initial trial, these participants were monitored for over 4 years in what is known as the Aspirin extension study. The original Aspirin trial, which was published in 2018, tracked participants for a median duration of 4.7 years. They were randomly assigned to receive either 100 milligrams of aspirin daily or a placebo. The new extension study continued to observe the participants for an additional 4.3 years, resulting in a total median follow-up period of 8.3 years. Professor Rory Wolf, the lead author and a principal investigator of the Aspirin XT study from the School of Public Health and Preventive Medicine, stated that throughout this extended follow-up, there was no overall evidence supporting the idea that aspirin could prevent cardiovascular issues. In fact, those who were initially assigned to take aspirin showed a 17% increase in major adverse cardiovascular events compared to those who received the placebo. This finding was unexpected and raises significant concerns about the safety of aspirin use in this demographic. The results from the original trial indicated that long-term aspirin use might not only fail to offer cardiovascular protection for healthy older adults, but could also substantially elevate the risk of serious bleeding complications. Our new findings reinforce these conclusions, Professor Wolf explained. He further advised that individuals currently taking aspirin for the potential prevention of cardiovascular events should consult their healthcare providers about possibly discontinuing the medication. However, he emphasized that this recommendation does not apply to those who have already experienced a cardiovascular event and are using aspirin to prevent further occurrences. Co-author Dr. Andrew Tonkin, also from the School of Public Health and Preventive Medicine, noted that while some individuals might still derive benefits from aspirin for primary cardiovascular prevention, it is crucial for them to weigh the risks and benefits in collaboration with their general practitioners. For those interested in delving deeper into this research, the full paper can be accessed here. European Heart Journal. /doi.org/10.093 UR/HART-J/EHAFF14. About Aspirin. Aspirin in reducing events in the elderly is a significant primary prevention trial involving over 19,000 participants in Australia and the United States, primarily targeting individuals aged 70 and older. This study continues to evolve as a longitudinal research project funded by the National Institutes of Health, USA, and the NHMRC, Australia. Aspirin is spearheaded by Monash University in Australia and the Berman Center for Outcomes Clinical Research in the United States. For more information, visit aspirin.org/AUS. This research raises important questions about the role of aspirin in heart health for seniors. Are we overlooking the potential dangers in favor of a long-held belief? What are your thoughts on the use of aspirin for primary prevention in older adults? We invite you to share your opinions in the comments below.